Okay, it's right about noon, so on the East Coast of the United States, so we'll go ahead and get started. Good morning, everyone. Good afternoon, good evening, depending on where you are in the world. Welcome to our briefing on the current Ebola outbreak in the Democratic Republic of Congo and Uganda. Today, we'll hear from on-the-ground experts about how we're helping these countries respond and how we're helping other countries, such as South Sudan, prepare. I'm Rebecca Milner, International Medical Corps' Chief Strategy and Advancement Officer, and I'd like to thank you for joining us today. We really appreciate your time. I'd also like to thank the many longtime supporters of International Medical Corps who are on this call today. Your generous donations make our work possible, and we couldn't do it without you, so thank you. As always, we are going to keep today's briefing as efficient as possible. Our session is only going to be 30 minutes long, which will enable our colleagues to go into a bit of detail and hopefully answer the many questions many of you have submitted in advance of today's conversation. If you have any further questions after the call, please, that aren't covered during our time today, please do let us know and we'll follow up. So just to get us started, as we all know, an outbreak of the Bundibugyo strain of the Ebola virus was first declared in the DRC on May 15th. The very next day, the World Health Organization declared the outbreak a public health emergency of international concern. Though the virus first emerged in Ituri province, it quickly spread into North and South Kivu provinces and crossed the border into Uganda, most likely because the virus had been spreading undetected in communities probably since late March. International Medical Corps, we already had a team in the DRC, and we quickly deployed rapid response teams throughout the eastern provinces, as well as to Uganda. Our teams are procuring critical supplies, building the infrastructure needed, providing training and patient care to fight this dangerous disease. In addition, our team in South Sudan has been working closely with government authorities and local partners to prepare for a potential outbreak there. I'm happy to have two of our experts with me today who are directly involved in our response and who will be providing on-the-ground insights into how we're working with communities to treat patients, improve infection prevention and control, and to dispel the myths and the stigma around this disease. We're delighted to welcome Dr. Michael Grady. Michael has more than 40 years of experience in medicine, including in infectious disease containment, emergency medicine management, and crisis response. He's deployed with International Medical Corps multiple times, including in Ukraine, Gaza, Myanmar, and to a number of disasters here in the United States. He's currently in the DRC's capital in Kinshasa. Thanks for joining us, Michael. We also have Dr. Abdou Sebushishe here today. Abdou is one of our senior global health advisors. He provides guidance and support to our health programs throughout Africa and the Middle East, and is an expert in responding to disease outbreaks. Abdou previously served as our medical director in South Sudan, and he's been a key player in our past responses to outbreaks of Ebola in the DRC. He's joining us from Goma, the town where he originally grew up. So welcome to you both. So glad you're here. So let's start with the basics, Michael. Maybe you could give us a very brief explanation of how Ebola sickens and kills people and how it's treated and how we protect ourselves against it and what makes this strain of the virus different.
Sure. So Ebola viral disease, or EVD, as we say, is a very serious infection with a very high mortality rate compared to other viral diseases. Of course, there are multiple factors that would contribute to that. The quality of the care that a patient would receive, how soon they receive that care, and other factors like the patient's age, other morbidities like diabetes, hypertension, etc. So the general health of the patient also contributes to this mortality rate. We are surrounded by viruses every day, and mostly our immune system sees and clears these viruses. Sometimes we get sick, like the flu or COVID, these types of things. This particular virus enters our body through contact with the fluids of a patient who is already sick with Ebola, or if by entering, for example, uncooked meat that where the animal has maybe been infected with the virus and died from that. Once the virus enters our body, it hijacks our immune system. It basically disables our immune system, then begins to replicate. The virus then can affect most of the other organs in our body. So we wind up with kidney failure, with liver failure, basically multiple organ failure, resulting in dehydration, diarrhea, acute fluid loss. And that's generally gets people sicker and sicker. And then there's damage to the little blood vessels that we have. This results in a huge inflammatory response and ultimately leads to death. And that's scary, and it is scary. But this particular strain is a concern because we have we have no vaccination for this particular strain, unlike the typical strain of Ebola that we've heard of in the past, the Zaire strain. And there's no known medical treatment for this, like the monoclonal antibodies that we use for the other strains. So this particular strain is of major concern and is, quite dangerous. Um, but we have to keep in mind that the virus is just a particle of genetic material. It doesn't have a brain, it doesn't think, it has no particular plan. And so, because we are used to this type of work and dealing with these viruses, International Medical Corps, this really is in our wheelhouse. We've done this before, and we're working desperately to get ahead of this.
Right. And so it's definitely a concern for the Eastern DRC and Uganda, but how should we view it globally? Should we be concerned, those of us that live outside the region?
It is it's a regional concern, and the WHO has declared it, of international concern.
Right.
That said, I think the chances of this getting into Paris or London or Los Angeles, someplace in the United States, I think is extraordinarily low.
Low.
I think we're safe, and I think if somebody gets sick, they'll be taken care of. But for somebody to just bring this home in their luggage, that's just not going to happen.
Happen. Okay. All right. Well, I mean, as you mentioned, we need to kind of get ahead of this virus. And maybe, Abdou, you could talk a little bit about the context in Eastern DRC that sort of allowed it to circulate for a while, but also um, is challenging to respond in that region, right?
Thanks, Rebecca, and thanks, Michael, for providing the background nicely about Ebola. So the DRC is the largest country in sub-Saharan Africa. It's quite a large country. And the east part, which is currently affected by Ebola, the three provinces, the size of the three provinces is literally the size of the US state of Nebraska.
Hmm.
It's larger than England,
Okay.
the area that has been currently affected, what we are calling East DRC. It's across three different provinces, Ituri, North Kivu, and South Kivu. So it's quite a large area. The DRC itself has been going through a lot of or different type of armed conflict that has severely impacted the health system as a whole. And humanitarian, like International Medical Corps, have been in this area covering the gap in terms of providing life for almost three decades because of the issue related to the conflict that has severely affected the health services here. There is ongoing and active conflict in this area. And the Ebola outbreak, this current one, started in Ituri, at least from what we know at this moment. And that region has multiple conflict, tribal conflict, and armed conflict of many sorts. but also it's a mining zone, meaning there is a huge mobility of population, not only from Ituri, but from other region across DRC who are going to do mining business in that region. So there is a lot of movement between Ituri and other provinces, and that's one of the key factors
Right.
showing how easily it could spread from Ituri now in North Kivu, in South Kivu, and even outside the DRC.
Right.
But also the conflict itself has affected the initial part of the response because the access to certain location to follow up contact or to provide safe isolation for people who are affected already, it's quite difficult if there is active conflict. That in brief, the context of where we are in DRC and what is happening here.
Yeah, it's a pretty densely populated area as well, right? I mean, as opposed to like the last Ebola outbreak was in a very rural province in, southwest DRC. And so that sort of helps like the disease kind of burn itself out, right? There just aren't many people around, but in Ituri, it's densely populated. There's lots of people there, right?
Absolutely. The last year outbreak that was declared over in November 2025 happened in a region in Kasai, a little remote area where the movement of population was not much between because of poor road infrastructure around there. So there are no a lot of mobility of population, but also the size of population was smaller.
Smaller.
However, this one started in a mining area with a lot of movement of population. It has reached urban areas like Bunia, like Goma, and Bukavu, which are urban area with a large number of population and moving across different region and even outside the country. And that's why this outbreak require a particular attention to ensure that it is contained as fast as we can
Right.
before it go even beyond its current provinces.
So as we respond, maybe you can kind of go through the elements of our response. What are some of there's the PPE, there's the Ebola treatment centers, there's a lot of components to our response. Maybe you could give our listeners like an overview of how International Medical Corps approaches this.
So International Medical Corps respond to the current outbreak like the previous one and like many others that we've contributed to by working directly through the response plan by the Ministry of Health so that we align properly with national effort and avoid duplication and use efficiently resources that are available. We need a lot of resources, so whatever is available, we need to use them in a structured and streamlined to one coordination. So we work through the Ministry of Health response plan, and that has 5 different pillars. And International Medical Corps is supporting 4 of them.
Okay.
We work through the pillar of case management, meaning we provide care, direct care to confirm and suspect cases who are sick with Ebola. We do also support the infection prevention and control, which is one of the key aspects in this outbreak, because it does not only involve the Ebola clinic, the way they call it, and I'm calling it to differentiate with ordinary service facilities. So we do provide infection prevention and control as well in different health facilities, ordinary health facilities. And if times allow, I can explain why we do that,
Mhm.
especially in this type of outbreak. And then we support the risk communication and community engagement, which is one of the key pillar to ensure we have the containment of any outbreak, especially the Ebola one. We need the contribution of every member of the community to be able to contain this outbreak and avoid that it goes beyond its current spread. So that is the risk communication and community engagement pillar. We do also support in surveillance and monitoring of contact where feasible. But also we support the coordination in terms of developing policies, updating those existing, and ensure that we have, but also training to ensure that even after this outbreak, we have a sustainable system that can respond better in future
Right.
outbreaks.
So
And,
next time, right. Yeah.
and those are the pillars that we
Yeah.
support.
And so when we talk about the patient care and treating confirmed cases, those need to be very specialized, I guess, facilities or treatment centers, right? And so we're actually building Ebola treatment centers right now in real time to be able to, to treat patients, right?
Yes, the in Ebola, one of the key measure that has to be taken in place is to take care of the confirmed case in a dignified and safe way. And this has to happen in a well-designed, dedicated facility to ensure that we protect the healthcare workers, but also we protect other patients who are coming to health facilities. That's how we create Ebola treatment center. That's how we build Ebola treatment center, which are well designed to respect infection prevention control that help to take care of the patient properly in a dignified way, but also protect the providers, the front line, and the members of the community. And that way we stop also the spread from one person to another. So, and international medical corps is one of our priority because, like in current outbreak, now beds of confirmed patients are becoming less. So we do build Ebola treatment center. Currently, we are operating three of them. We have one Ebola treatment center in Ituri, Bunia specifically. We have one Ebola treatment center in Beni, which is another area that where we are seeing more cases and epidemiologically have more risks. And we have a transit center in Goma and Bukavu. These transit centers are a little bit different from the treatment centers because they do provide space to care for those suspected who are not yet tested to avoid mixing them with the confirmed cases where they can potentially be infected if they were negative. So we put them in a safe place, provide them care and test them. Once the result come, we decide whether they can be mixed with other patients or they can be transferred to the treatment facilities. And we have 7 of those. Those are the type of Ebola clinic, if I can call so, that International Medical Corps is currently working on. And because of the need that we see on the ground, we're working on scaling up the treatment centers in various geographical area. As I mentioned, this area is quite huge, more than England. So we need to cover those hard to reach area and put innovative ways of taking patients from wherever clinic or wherever community they are, even it hard to reach, and link them to treatment facilities and provide care. So we are scaling up this and we are aiming to have more than 7 treatment facilities in the DRC, but also additional transit centers.
Okay, right.
However, this
And then also to sort of, multiply the impact of what we're able to do, we're providing training to MOH staff and other frontline responders to help them understand, personal protective equipment, what keeps them safe, how they can do that, all of those things, right?
very important question, Rebecca, but allow me because it's very important. Allow me to be a bit long for here.
Sure, sure.
We do focus a lot on training, and this training is not only for healthcare workers working within Ebola centers. We do provide trainings for also healthcare workers in regular health facilities because when Ebola is there, the most vulnerable group of people that are exposed to be infected are healthcare workers. They are the point of entry of all the patients. When they have fever, they go to see the doctors.
Right.
So the doctors, the nurses, and everybody working on the front line are at high risk of contacting Ebola. So they need training in addition to equipment that protect them. If that is not done, they don't have the confidence. Recently, I saw on social media a doctor a photo of a doctor that was infected by Ebola that was spread on social media. The effect of that, it creates fear within other healthcare workers. And that fear can be addressed through training because training builds confidence.
Right.
Once we provide training, we provide the right prevention equipment and train the people how to use them. Train them on how to identify, screen, triage, and refer patients who are linked to Ebola or related to Ebola. It gives them confidence to be able to provide regular services. That way, we maintain the continuity of regular health services such as children vaccination, pregnant women who have to deliver by skilled workers, and avoid the community to use alternative medicine like traditional
Mhm.
healer, which also
Right.
spread further the infection.
Right.
So training help to maintain the continuity of services as well, plus equipment that are provided. Because in Ebola, like what we saw in West Africa, it's not just fatalities related to Ebola. It's also fatality related to the presence of Ebola in a place
In
like
the
this.
community.
It cause if a healthcare worker is infected, the rest of his colleagues are considered to be contact, so they have to be quarantined. That health
Mhm.
facility will have to scale down, and
Right.
regular health services will have to stop. And we will have the people who will have access to those limited number of functional health facilities will have nowhere to go, even if they don't have Ebola, and they will end up with a lot of other problems, including
Right.
fatalities. So it's
Right.
some effort to prevent that we provide extensive trainings for a large number of healthcare workers in different health facilities, including the Ebola clinics, to
Right.
ensure we give them confidence and the skills to use the protective equipment, but also to identify and support the treatment of patients safely and in dignity. But also the training help us to leave a sustainable system behind because these healthcare workers that we do train will remain in the community and will provide that knowledge for years and years. And that way we contribute to a resilient community that can respond better to future outbreak if they happen.
Yeah. Well, Michael, I want to go back to you when Abdou said that we were working within the national system. I mean, your role in Kinshasa is to help us with that coordination. How do you think that's going? And do you feel that there is proper international support for the government of DRC?
Yeah, so whenever there's a public health emergency, whether it's an earthquake, a war, infectious disease outbreak, the outbreak of a deadly infection like this, it's our responsibility to coordinate with other partners, um, not just so that we don't duplicate services in a particular area, but that we are able to provide services in areas that have the most need, that have no other services. So we are doing that, and it's our responsibility, to report back to these partners accurate data, what's going on. We take that responsibility extremely seriously. When we talk about partners, there's what we call implementing partners and funding partners. And
Mhm.
so in terms of implementation, there's really only three accredited groups in DRC that are doing this type of work, and International Medical Corps is one of those. So coordination with WHO, with MSF, all these other partners is critically important. There has been an international response to this. We've received funding from lots of different directions. It's critical. It needs to continue for us to do this work.
Yeah, and I would just add that one of our key donors is the U.S. government. So the State Department is supporting international medical course response, and we're very thankful to be partnering with them. Um, yeah, I mean, I think coordination is there, and is there a concern that there might be cases in Kinshasa? How is that evaluation going?
So Kinshasa has a population that probably exceeds 20 million people. It's huge. And so we're very concerned about that possibility. We watch it very, very carefully. We get updated numbers daily here, if not more frequently than that.
Mhm.
We have already begun discussions about pre what we're going to do should a patient arrive and test positive in Kinshasa. So we're already on that. We watch it carefully, and fingers crossed that's not going to happen, but it could, and we're preparing for that
Yeah,
possibility.
yeah. Well, we're almost at time, and just sort of before we end, I mean, is there some highlight that you'd like to share that is indicates, sort of some success or positivity, whether it's somebody that you met or an action that we're all taking that makes you feel like we're heading in a positive direction? I mean, Michael, do you want to start, and then we can go to Abdou?
Yeah, I mean, as Abdou said, the silver lining here is that we're providing not just materials, but instructions in very simple care, like we call it IPC, infection prevention and control. And so we want to leave a footprint at these healthcare facilities so that they're better prepared for this the next time. Um, Abdou and I had a mutual mentor in the humanitarian space. We were talking about this just yesterday, Rebecca, who said that more people are going to die because of Ebola than of Ebola. And so I think that's the silver lining here, that we're setting up these healthcare facilities to remain vigilant when this is over and to have good hand washing, good prevention, good infection prevention control. So that's the silver lining for me.
Right. What about you, Abdou? It's not your first
Uh,
rodeo, as the Americans say.
Yeah.
uh, First of all, thank you, Michael, because that's very important to just say, and I don't, I wouldn't add anything on it, but I would like to say that the need here is huge, and the work, especially on the people on the ground, the expectation of the communities toward the responders is also huge. It keeps us seriously busy, and sometimes we don't find time to have even breakfast. The majority of the responders.
Right.
Some of us work within hot environment, wearing those heavy protective gear, which are very hot. However, with all those stress on them, something keep them going. It is when they don't feel alone. When we have a lot of partners, donors, like you mentioned, the US government, when we learn about a lot of people who are willing to provide the support that is needed, asking, what do you need on the ground? That provide an additional motivation to the responders on the ground. And that's something that keep myself and other responders here moving. So I would like to end with a note of gratitude to everyone supporting effort here on the ground. Resources are still needed, but thank you for what has been done so far. I think I would stop there.
Yeah, thank you, Abdu. Thank you, Michael. We really appreciate that. And thank you to everyone who joined the call today. I mean, it's a rapidly evolving situation and our response is changing accordingly. So, please do follow us on social media and visit our website to keep track of our response. And as Abdou said, thank you so much for your support. It does make a real difference, and we're very grateful for it. So thank you so much, and we look forward to seeing you on the next briefing call. Thanks, everyone.